Hi, Dr. Thayer here. I'm with Noel. He has found me from YouTube.
Yes.
YouTube. And so he's been having trouble with his arms. He's a surgical nurse. He's having trouble at work. He's been dropping some things, and he's been troubled with his numbness and tingling in his hands for a while. Some weakness has been occurring. He's been seeing the joint for 2 to 3 months here. Going, how often did you go?
I was averaging once a week.
Once a week. So he went and wasn't getting any care there. Not, he was getting care there. Wasn't getting the results he wanted, right? Gotcha. So felt good, I guess, to get adjusted, but your hands weren't coming back. You weren't feeling anything.
Right.
By the way, they don't take any X-rays there. Shame on them, because when you guys do see his X-rays, he has lots of stuff going on with his neck. Okay, and so he has a big old huge osteophyte off, I think C4, C5. Big old huge osteophyte at the back of his head, huge. Atlas is completely worn out. All stuff that should be seen and should be addressed as a chiropractor. Because you take X-rays, you can see that stuff. So again, X-rays are important. So surgical nurse, tell us your story. Why are you here?
So for the past year and a half, I've been having tingling and numbness in my arms, mainly in my left arm. I've tossed and turned all night. I have to sleep with
Because of your hands, you toss and turn all night, you think?
Because of, well, I think it's because of my hands, but then I also wake up with neck pain. I do have to sleep with a special pillow and sleep upright, and I still wake up with my hands feeling numb, sometimes to the point to where they feel swollen.
So he got this little airline pillow he puts on his neck, which is fine. It makes him feel better. But he's like, I think I've solved it. I'm doing pretty good with this airline pillow. I go, so why are you still here? So it's still, some of the symptomatic relief you get from some of these things they're doing, guys, is great. It changes, it tricks the body a little bit, but you still need to get treated. And you guys are going to see the results of the actual chiropractic adjustment and what happens and how much more powerful a neck adjustment is over a year and a half of it. Do whatever he's done. Okay? So, so we got neck pain. Where's neck pain? Where's neck stiffness?
Mainly in the center, up towards my head, kind of drifting off to the left a little bit, not
Gotcha.
too much.
Okay. What's wrong with your arms? What's this arm?
This one's numb. And
That one gets
tingling.
numb?
Yes.
Okay. And this one?
Same thing, the tingling sensation, not as numb as my left, but same.
And it's weaker on this side. We're going to test that in a second. Surgical nurse, tell us about dropping things.
So I pass instruments for my job, and what happens is sometimes I have something in my hand and I think I'm gripping it hard enough, and it happens to just fall out of my hand sometimes. So I actually have to grip things a little tighter to avoid dropping things.
Gotcha. And tell us about the thing you said yesterday, or the day you came in to do your exam, when your arms are away from you. Tell us about that whole thing.
Oh yeah, when my arms are away from me, that's the sensation of numbness gets worse. So if they're by my side, they're okay, but as I extend my arms in front of me, I start to feel the tingling sensation.
He brought that up on his own, and the reason I'm having him do that again is because that's a perfect example of leverage. So the further that you go away from your arm, the more muscle is involved, more traps are involved, more neck muscles are involved, more arm muscle involved. So it's crimping down the nerve, it's causing more problems with his hands and tingling, and so that's all a leverage problem. So again, just more conclusion of more evidence of how that works. So let's see, you sleep like crap. 2007, rear-ended, hit so hard that he was sandwiched between 2 cars and he hit his head
on the windshield.
Boom. No real treatment for that. Did you go to a chiropractor back then for that?
I think I went to an acupuncturist.
Acupuncturist, but again, windshield, hitting your head in the windshield causes a lot of problems with the upper neck. He could have started all this problem back then. It's not a good injury to have, and so anybody who's been in an accident where you've hit your head in the windshield, you can have a lot more upper cervical problems than you even imagine. So that's a bad one. He doesn't realize how bad that was, but that's a big one on my book. Anything else you want to add?
No, I think for the most part it's just the numbness and the stiffness in my neck.
Yeah. Good. So let's test him, okay? Over here. So go through the low back real quick, just bend over, touch toes. Okay, go and stand up. He said he had no pain before we already done this test, right? Go back real quick. Good. Okay, let's check your neck now. Look at the floor. And so you said, what is this pain in your neck now?
I think I said it was like a 3 before.
It's about 3 right
3
now?
or 4, yeah.
3 or 4 right now? Gotcha.
Stiffness.
And it's called stiffness. He doesn't call it stiffness because he doesn't want to admit it's pain, which is fine. That's what he calls it. Look at the ceiling. What's that one?
Like a 1, 2 maybe.
2, okay? And look straight ahead. So he seemingly doesn't have a lot of pain, but he has a lot of symptoms associated with a chronic neck problem. So interesting how the body shuts down the interpretation of pain. Okay, so let's check your hands. Squeeze my hand as hard as you can. Okay, this is a big boy, and I'm squeezing, and you're squeezing pretty hard, right? And it's weaker on this side. Squeeze. That one's stronger, right? But it's number. You told me it was numb, right? Okay, where is it numb in your hand right now?
Probably these 3 fingers.
When you squeeze it, numb a little bit? Gotcha.
All with my arm.
Gotcha. When I squeezed this one, it was weaker, but it didn't go numb, right?
Just it tingles.
It tingles.
Yeah.
Gotcha. But this one was number.
Right.
Okay. We're also going to do dermatones. Let's turn towards me a tiny bit like this. And so pump like this. Good. We're going to check his dermatones, guys. You guys know what this is. When you have a proportion on either side that tells us one side is being cut off. So we're going to check this.
I feel more on this.
Okay.
About the same.
About the same.
Slightly more on this side.
Okay.
Yeah. I don't feel anything on this side.
You don't feel anything on this side?
No.
Gotcha. So this side is numb over here. Gotcha. Okay, so ready to get adjusted?
Yep.
Okay.
I'm ready.
Let's take the glasses off here. Put it right here. Go ahead and lay on your back over here, sir. Why are you laughing?
A little slippery.
Oh, slippery. Yeah. So, is this the biggest ass surgical nurse you ever seen? He used to play football. And so, the reason I wanted to adjust him today, because he has a 15-inch neck. Can't wait to adjust him. So, let's see, anything else? We talked about the x-rays already, and then let's get you adjusted. You excited?
Yeah, I just want to feel my arms again.
Yes. Okay, good. So just relax best you can. Hands perfect right there, and you're doing great. Good. How was that?
That was different than how everyone else adjusted it.
Okay, so how is it different?
The angle that you put my head in and how much you turned my head. So yeah, it was different. I felt it pop to the center of my skull almost.
Yeah, and did you feel it pop before the other doctors? Like that? Not like that.
Not
right?
like that. No.
Okay, gotcha. How many different doctors of the joint did you have? Just the same one all the time?
It's
or
2.
2 different ones? Okay.
Yeah.
And what else do you have? Any other kind of comment about that? I'm always curious what you think.
It was a lot of torque.
A lot of torque.
It was like, yeah, and it was just a weird feeling. It's different. I've been to the other guys and it's just different.
Yeah, and the reason I'm asking you this question, going a little bit of longevity on this, is only because people are going to wonder how the joint is different than what I do.
Yeah.
And so it's just a different type of, more torque, more power. Right?
Yeah, it's different.
Gotcha.
I don't know,
No problem. It's okay.
It's hard to explain.
As one guy said, how many patients? It's like a breath of fresh air. Remember that video? Okay, so one more time, okay?
All right.
Why are you laughing?
My hands are feeling numb.
Well, yeah, well.
Or not numb, but warm.
Warm. Thank you. Yeah. He doesn't know what the hell he's saying. He doesn't know what he's saying. Okay, so just relax, okay? So again, just different, right? More torque, more power. Anything else you want to add to that?
It seems like the adjustment was higher in the neck than with the other guys.
Yeah. And I'm not even going very high in the neck. That was mid-cervical adjustment, guys. Mid-cervical, not high neck. Wait till I adjust his high neck. That'll be a whole different enchilada. Okay. So Noel, when you get up, no twisting or turning, just like I say in the videos, right? The more you twist and turn, the more you got to undo my work. You're going to look straight ahead, keep your arms at your side, no checking to see how you feel. Do not check until after we do our walk, okay?
Okay.
Gotcha. Sit up. Throw your legs to the side, just sit down at the table, please. Look straight ahead. Okay, off the top of your head, what do you feel? Don't check. I just want to know, just without even really going through any range of motions, just what's the initial feeling you have?
That feels like I actually have a neck this time.
I know.
Yeah.
Yeah, that's funny. Why, anything else?
When's
When's the last time you had a neck? You were in high school.
Never. And it just feels. I feel like I'm a little straighter.
Gotcha.
My shoulders just feels. I feel taller above my shoulders, but.
Yeah. You ever have this feeling ever with any other chiropractic adjustment ever?
No.
Not even close, right?
No.
Yeah. So you already are seeing a difference with what we do here. So I'm glad. Let's see more of a difference. Let's go for a walk. That walk helps recalibrate your spine. The adjustment I did in your neck is going to spread through your whole body. Do not interrupt the process. Again, straight ahead, arms at your side, relaxed, walk.
Okay.
Do you need your glasses to see it all?
I guess.
Then just come back around. I'll give them to you as you come back this way. You're going to stop right here and then go back to the door, please. Go out of the door. Back to the front door. Okay, just let your body relax. Look straight ahead. Lightheaded, dizzy at all? Tiny bit, huh?
Maybe a little lightheaded.
Yeah. Back here, one more time to the door, please. In your nose, out your mouth. Breathe, breathe, breathe. A little better?
A little better.
Still a little dilated. You still see his eyes, guys. Still a little dilated. Still a little off, right? You still feel it, right?
Yeah, just,
Yeah, see it. One more time. Again, I say this every single time. The reason why I have him walk is not to have him walk until he tells me what I want to hear. His body is changing right now, and his neck adjustment is spread through his body, and that imbalance, the dilation in his eyes right now, it's a little better, it's still a little dilated, is his body trying to work out the crap, and his body's trying to uncompensate for all the stuff that's going on for years, and it's happening at a rapid rate. One more time, let me see.
I feel confused.
He's still, yeah, confused, huh? Yeah. Yeah, so we'll get him tested on this next one, but you can see it in his eyes. You can actually see how he looks. Stop right over here. Okay, so without moving again, how do you feel different right now? Still taller, the neck feels...
I feel a little taller. I feel straighter. My neck doesn't ache. It's that aching feeling that I had before too, the stiffness. It's kind of...
With the fingers and the tingling?
The tingling is much less.
How much less? 10%, 20%, 30% less? 40%, 50%?
I would say about 20% less right
Gotcha.
now.
Okay, cool. Anything else? Ready to check everything?
For some reason, I feel like I can breathe better.
It happens a lot, guys, because you know something? When the neck is adjusted, it releases, it balances the body out. His posture sucked before, so now his posture is like this. Now it's a little open. His rib cage can take a bigger inhalation. His lungs can fill up more, so that's absolutely true. It happens all the time. Okay, so let's go through range of motion. Step back. Okay, touch toes. Had no pain there. Go and stand up. Any difference in sensation there?
No, not too much.
Okay, change your back. Move back real quick. Let's go through these with GP. Okay, look straight ahead. Now look down at the floor of your neck. That was a 3 or a 4 or 4, I think you said. What is that now?
Probably 2.
2, so half, 50% better. Look at the ceiling. That was a 2. What is that now?
No problem.
0?
Yeah, it's
You said a second ago that you said your neck stopped when you went back. Is that stopping not there anymore?
I could feel like it looked straight up now.
Yeah, good. Look straight ahead. Let's check your strength. Squeeze. Oh shit. You feel the difference?
Yeah, a little bit.
No, a little bit. Was there a difference?
Yeah, I felt like I actually gripped something.
Yeah. Very good.
Yeah.
It's
a
a
little,
it's a little bit stronger, huh? Let's do this side. Now tell us. Oh crap! He's a strong boy. Now what about
you
the
can
tingling?
actually. The tingling kind of went away. It's still there. It hasn't gone away completely, but it's.
Oh fuck! It's killing me.
Yeah. I can actually grip a little bit.
I'm like, I told him, like, he goes, oh, I go, you're killing me. He goes, oh, I'll hold back. I go, no, let me have it, because before it wasn't that strong, but
Yeah. I
like vice grips now. But you said every time I grabbed his left hand, it tingled. Is it
Right.
different now?
It's different.
Gotcha. What do you think so far? Is there a change?
There's a change. Yeah.
Good.
As soon as I got adjusted, my hands got warm.
Yeah. And so, did you ever have that feeling again?
No.
Yeah. All those other wasted adjustments. You get what you pay for. Look at. She doesn't like when I say that stuff. Okay, let's check the sensation real quick. Come over here closer. Go this way a little bit. Okay, good. So same or different?
Can you do that one more time? Close to being the same.
Okay.
Same. That's the same now. I can feel on this side a little bit better.
So see, now look at this guy. He wants me not to be successful. Put your arms down. Because he's like, this is like, same. He's trying to see that it's not going to work, but it's working, right? You said you see a difference.
Yeah.
Are you happy with the results first day?
Yes, I am.
Don't squeeze this time. Thank you for coming, and thanks for letting me adjust you. See you guys next time.